You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, it's an extreme makeover edition of The Wellness Hour, and we're talking about cosmetic dentistry. With us, we have San Diego's cosmetic dentist, Dr. Briscoe. Dr. Briscoe, welcome to the program.
Thanks, Randy. Good to be here.
All right, now you brought a lot of photos.
Right.
And these are nice photos. And now before we get into today's topic, tell me a little bit about the procedures you do. I mean, you do more than just cosmetic dentistry.
Absolutely. We do teeth whitening, where we do in-office whitening, have a couple different systems.
Your teeth, by the way, when I saw you, I said, these are the whitest teeth I've seen on a dentist.
Power bleaching.
Power bleaching.
Right.
So those aren't veneers?
No.
Wow. Okay.
So what we do with power bleaching, and we guarantee that we can whiten patients' teeth with this. So we'll send patients home. They do 14 to 21 days of teeth whitening at home. Then they come in and we do a power bleaching session in the office.
So 14 days of bleaching.
14 days of bleaching.
They have to take 14 days off of work for that?
No, they just
no, I'm kidding around.
Spend it at night, sleep through the night. We make custom trays. We don't even make them. We send them off to the lab to have those fabricated.
So these aren't your typical trays either?
These are not.
Is that right? Because I heard you describing it when I was talking about your teeth when you were getting makeup, right? You were a little shiny, okay? And so these trays, I mean, how are they different than traditional trays?
They fit around the teeth so precisely that when the patients put the bleach into the trays, put the trays in the mouth, that bleach stays in the trays up against the teeth for the 6 hours that they wear them. Typically, they wear them all night while they sleep.
Okay, so the other procedures you do sedation dentistry, you do veneers, you do dental implants. What am I missing here? You do root canals?
We don't do root canals. We do onlays, crowns, bridges, veneers, cosmetic procedures that enhance the smile, but also those restorations help support the teeth in the bite. So they add some strength to the teeth.
And I told you that I'm a connoisseur of veneer. I mean, I could see veneers walking down the street. But you said not my patients.
Not my patients. Let me show you the picture.
Okay, let's take a look. Let's take a look.
Okay, here's a lady so she'd been in our practice for a long time. She always hid her smile whenever she laughed. When I was in the room, at least, she covered her smile.
Really? They cover their mouth even at the dental office?
Right, especially at the dental office.
Interesting.
In front of the dentist. So she'd asked us several times about what could be done, and she had options of orthodontics, traditional braces, Invisalign, or we could do instant orthodontics.
Orthodontics.
With veneers.
Okay.
So that was something that sounded appealing, and she deliberated for 2 years over that before she finally decided. And then she and her husband moved out of the area. But she flew back to San Diego so that we could do her veneers. We did 12 teeth on the top, 12 teeth on the bottom, and created a gorgeous smile.
Let's take a look at this. Let's take a look at this. Beautiful.
Now, she's a gorgeous lady to begin with. So what we did is created a smile that was fitting for her. Notice how the teeth follow the lip line. So aside from the appearance, Randy, this woman's self-esteem has been improved. She feels more outgoing. She's more approachable. She smiles more. So people interact with her more.
Okay.
So we have somebody who was a little closed in. Now she's wide open for people to talk to, be involved with, go to events in the community, and live a life that she should be living.
So what are the age ranges of patients that, the upper ranges for cosmetic dentistry, for veneers?
We've had patients up in their 80s that have done veneers because they've lived with their smile all of their life, and they want,
Is that right?
They want something that's more modern, more contemporary, in line with the times. So look at this case, Randy. This is a lady who's in her 80s.
Wow.
She lived all her life with this. Teeth overlapped, crooked.
So she's 80 years old. She goes in. What does she say in the console? What can you do for me? Does she think her teeth have to be removed?
No, she simply wants to find out what her options are. And her husband actually is who brought her in.
Okay.
Because we had done his veneers, because he had felt that he was losing self-confidence. His teeth were deteriorating over time. So we did his upper and lower veneers. He said, wow, this works for me. Let me bring in my wife.
Okay.
She wasn't as keen on this, but after some discussion, she warmed up to the idea, and we created a smile that's...
So with her, what'd you do? Okay, so on that before, you took that. So what do you have to do? You put veneers in this particular case?
We did veneers on her top teeth and her bottom teeth so that we lined them up nicely. We made the central incisors longer, the lateral incisors a little shorter. We blended in the shade so that it matches the rest of her teeth. So Randy, she looks 10, 15 years younger than she actually is.
Yeah.
Look at the before, look at the after.
Now, this is very nice, by the way. And so with her, again, she was reluctant. She didn't want to do it. Her husband talked her into it.
Right.
And then you talked her into it after that, right?
We gave her all the good reasons why she should do this.
Okay, I'm putting you on the spot. Okay. So between both her husband and you, she couldn't walk out of there. But what'd she say when it was all done, by the way? I mean, that's huge.
She loved it. She never knew that something like this could be done. And this is like so many people in San Diego.
So there's a lot of people out there that, and you know, when you look at the before and after, I mean, the perception of this woman is healthy, vibrant, and it's a sexy look. I mean, it's a pretty look.
There's a lot of ladies in San Diego that are like this. They have old smiles. They take care of their skin, their hair, their makeup. They wear nice watches, carry nice handbags. They're always dressed to the nines when they come into the office.
But they have old teeth.
They have old teeth, old smiles.
I mean, you see this when you're out and about, by the way?
Absolutely. So, and I'm not sure if it's fear of the dentist or if they simply don't know what can be done.
Now, these people, were they, I mean, did some of them, I mean, you offer sedation.
Correct. We offer nitrous. We offer oral conscious sedation.
Nitrous is the mask.
Correct.
Right? Okay.
Laughing gas.
I just had that. I told you.
It's
routine checkup.
It's like a day at the spa, isn't it?
In North County, it was like a day at the spa. It was so relaxing. And I mean, I literally couldn't wait for the next appointment. I mean, you're just kind of mellow. It's nice.
The way we approach sedation is it's really a luxury where the people can come in, they can totally relax, their mind shuts down, their body relaxes, and we can get a lot of dentistry done in a short amount of time. And
does it make it easier on you, by the way, when they do it, because they're not?
Anxious people are hard to treat if they're not sedated. Normal patients work fine without sedation. But the sedation on the folks that are very anxious works great. We can move through our procedures efficiently, rapidly, get a lot done. They don't have any recollection of their visit with us afterwards.
Now, do you have a picture of her husband? You said he came in first.
I do, and it's right here.
All right.
So he had lost
oh my goodness
self-confidence that he had previously in his smile.
What's going on there?
His teeth are eroding, they've chipped off, they're breaking down. So he had lost the self-confidence that he used to have, and the smile that he was accustomed to was really but a memory.
Is that unusual to see something like that?
Not at all.
No.
Because
you never see that.
You never see that because people that have these types of smiles typically don't smile.
Okay, good point.
And they may be people that you think are stuck up or unfriendly. Mad, but they don't like their smile.
So all the miserable people that I see, they probably just don't like their smile.
That could be a big part of it.
That could be it. Okay, they need to see Dr. Briscoe. Okay, so with him, what'd you do?
He came in and he wanted a solution to his problem. We didn't have to try to convince him.
He said, I want veneers.
He said what could be done, and he was thinking crowns. We said, no, we can do veneers. They're more conservative. We can get a nice color, get the bite set up for him, and he could smile again. So here's a guy, didn't like his smile, wanted something, so we went ahead and did veneers on the top teeth and the bottom teeth.
And that looks good.
Yeah, and it's natural looking. It's not something that jumps out at you as being phony.
Let me take a look at this. Okay,
it's age
so
appropriate.
This guy went from those teeth to this. I mean, he's got to be excited about this.
He couldn't believe how nice things could look.
And they look real. They look very nice.
He wears them well. And so he went home and talked to his wife about this and got...
And this is her. This is her right here.
They're a beautiful couple together.
Yeah, that's very nice. It's very nice. So with him, I mean, so color, you're involved in color, the shape of the teeth. I mean, what is your goal? When you look at somebody, what are you thinking? Like, what goes in your mind when you're looking at somebody like these patients?
When I see somebody like this, I always look to see what can the end result be? How nice can I make this person look? And of course, has to be something they want too. We listen to what their desires are.
But you see it. I mean, you see that end result in mind?
that we start with the end result, and then we work backwards from there. How are we going to achieve that?
And what I
do we
think
need
is
to
nice
do?
about your office is you do like a temporary mock-up, like prior to the veneers, so they get to see what it's going to look like prior to.
Absolutely.
And if things need to be changed, you could change them.
We prepare the teeth, we put in temporaries, and those are made ahead of time to look like the final result that we want to have.
So if changes have to be made,
Changes have to be made, we do them with the temporaries. Patients wear those for a while. They can come back the
Couple
next
of
day,
weeks.
a few days later.
if they don't like them, you could make what?
We can make
Contour
them longer,
changes?
shorter, recontour things. So
And then they wear them another couple weeks and come back and make more changes? No, I'm kidding around.
people like these, they're big changes going from where they were to where the temporaries were. So they need to get used to them sometimes. So
Yeah.
they see teeth that are bigger, they're lined up more, their tongue can glide across the edges of them.
Was she glad she did it? Because, again, he told her to do it.
She is. She's absolutely ecstatic. And we got an email from them. They were off on a trip recently, and she needed to stop and see a physician. So he walked into the room, and he had her chart. He knew how old she was. She smiled at him, and he said, "This can't be right. You have a gorgeous smile." He thought,
How could you be 80 years old?
exactly. He couldn't
Did
believe
she
it.
say Dr. Briscoe, I hope?
I hope so. but her husband emailed us that evening.
Telling the story.
Telling the story, because he was the one that promoted this treatment. He's happy when his wife is complimented, and she seems to be over and over.
Wow. Well, that's a positive story. We're going to take a quick break. We come back, more photos. We have time for some more photos. And I want to know about the process. How you determine what their smile is going to look like, whether it's imaging or a smile catalog or whatever. Okay. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about veneers and how Dr. Briscoe designs your smile. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Smile makeovers today. With us, we have San Diego's cosmetic dentist, Dr. Briscoe, getting a lot of attention because of the results he gets. In fact, newscasters, people in the public eye, when they want a natural smile, they don't want all their friends to know that they have veneers, they go to Dr. Briscoe. Is that right, though?
That's right.
I got to be careful. I sound like I'm endorsing you, right? We met today. This is but your before and afters are really good. So good for you. I mean, they're very natural, and it's obvious why you're so busy.
Well, it's exciting to work with people that come in. They are interested in cosmetic dentistry, and we have the opportunity to serve them with all the different things that we offer. We can clean up their gums. We have lasers.
Yeah, what if they do have bad gums?
It may take a visit with the periodontist, the gum specialist, but for most of the cases, we can take care of things in the office with traditional hygiene visits, and we also have our laser where we can do laser therapy on the gums.
Laser's pretty popular now.
It's a godsend. I mean, we can...
A godsend?
A godsend. We can sterilize the pockets. We can clean up the tissue.
What are pockets, by the way?
Pockets are areas where the gums don't attach against the teeth.
Okay.
The way they should. So we've got to get the gums to reattach into the roots so that we have healthy support. And if we keep the gums healthy, we can keep the bone healthy. The bone stays healthy. The teeth are going to stay in the mouth.
So when I saw that power couple we refer to,
right?
I mean, there was pretty bad teeth. So they had gum disease that you had to clean up first.
Had to clean that up first, and
and
it took a few visits, but they were game for it, and we wound up with healthy tissues, and then we can build our veneers on top of that, and that works well.
And
for
they could be
us.
sedated the whole time with nitrous or whatever.
Absolutely. We have patients that come in, we do the exam, and then we move to sedation, and we do everything under sedation. All the procedures we do can be done.
Okay, now, before the break, I said, okay, so take me through the process. Day one, how does somebody decide, or how do you show people what their smile is going to look like, or what the potential is going to be? So like a veneer consult.
So they come into the office, we talk about their particular situation, what their concerns are, likes, dislikes, take some photos, project them up on the monitor. At that point, they're a little detached from their own smile, so they'll be more critical and open about what their concerns are.
Okay.
So we can sit there, make some suggestions.
So you put like those retractors, you take pictures?
We do that.
Because nobody's smile looks good with those things.
No, but we also do a natural smile. so they
Okay.
can see their teeth as somebody else would see them.
All right.
And then, what is it you don't like about that? What would you like to have done? Because everybody's concept is, oh, give me white teeth and everything will be fine. The whiteness of the teeth is great, but the bigger concern really is tooth position. How in the mouth do those teeth sit? And do they sit next to each other, or do we have overlaps, like these pictures that we've shown here? Are there crowded areas?
So what do you show them pictures of what? Computer imaging?
Well, we start with a catalog of our own patients that are similar to what their condition is. And we can show them before and afters of cases that we've already done.
Do they pick their smile on the computer? Do they say, I like that?
A lot of them do. Some of them come in with photos that how their smile used to look, and they want it to look that way.
Is that right? They do? They bring in photos?
They bring in photos, and those are great. Can't always see the teeth as well as we'd like.
They bring in
but
celebrity photos?
They bring in celebrity photos, sports photos, people that they want to look like, and we can do the teeth.
All right. All right.
Can't always do the rest. But
Okay. So you get an idea from the imaging or the photographs or past patients,
right.
and then what?
And then we decide, okay, here's what can be done, how many teeth are involved, how long it'll take, how many visits, and
then go from there. So you do Invisalign as well?
we do. So we can move teeth around, line them up, take away the overlaps and the crowded teeth, and set them up. You do some Invisalign, do some power bleaching, and you can create some nice smiles
And power
that way.
bleaching is what you did, right? Because you do
Absolutely.
have the widest teeth of any dentist that's ever been on this show.
Okay,
And it's power bleaching.
it is. And, and it works well. It's something that,
I've never heard of it. I mean, it's these special trays, not typical trays.
that's correct. Special trays. Patients have to spend some time with the trays. Once that's accomplished, we have a beautiful smile, and we can
So they're special trays. I mean, they're tighter. I mean, you actually send them out.
send them out to be made. Patients wear those for 2 to 3 weeks
While they're sleeping.
while they're sleeping.
Okay.
And then we can do the in-office bleaching, and we've got ourselves a beautiful smile.
Beautiful smile.
And we can maintain that if they'll do one night a month
One night a month.
of whitening.
Okay, good, good. Now, okay, so more photos. What are we looking at here? What are you going to show us next?
So this is Pilar.
Oh, my goodness.
She's a patient in our practice, had been for many years, and as you can tell from the photo, it's more of a grimace than an actual smile.
So she doesn't like to smile.
She really doesn't. She has had implants and bridge work done, but her smile never really got accomplished.
Okay.
So she wanted to enhance her smile, look better, feel better about herself. And so we created a smile that was befitting
So what did you
her.
do?
So we took her from this grimacing smile that she didn't like to display to a smile that knocks it out of the park.
Wow, let's take a
So-
look at this. Let me see this. This is nice. Yeah.
So she has longer teeth than she had previously.
Very interesting. Very interesting.
They're a little further forward, so they're more prominent in her smile.
Now, did they have to learn? I mean, because we talked in the green room, they have to learn to smile again.
They do.
Because she had that smile before.
Right, and so they shut down. They're not used to moving their lips and actually smiling. So now she's
She
learning.
looks like such a happy person.
I think
this.
she always was
can't
inside,
imagine,
but she
seeing her
never
not
displayed
smiling.
it. So now she's always complimented on her smile. She loves.
Does she tell you that?
She does.
She said,
And
I'm amazed at how many people compliment me.
And fortunately, she tells a lot of her friends where she got that done.
Go see Dr. Briscoe.
That's right.
The king of cosmetic dentistry in San Diego.
So we appreciate that.
So somebody watching this, because turnaround time, in a perfect world, how soon can the turnaround be? I mean, 4 weeks, 3 weeks?
We could do it in as few as 2 visits. We've done smile makeovers in a week. They'll come in on a Monday,
Okay.
and we'll finish them on a Friday.
Is that right? That's 1 week.
1 week.
So, I think it's great, though, because, you said this on the show. Now, everybody's going to want that 1 week smile turnaround.
That's great.
You said it, doctor, on TV.
We're happy to do that.
But really, about 4 weeks is ideal. Is that right? 4 or 5 weeks? Depending on how many...
Depending on how many teeth we're treating, yes,
Okay.
that would work comfortably. Once we get the temporaries on these people, they're in love with those. So it's really the first visit where we start doing treatment that
You see changes in their self-esteem or the way they act?
absolutely
The way they
they
dress.
start to smile more. They feel better about themselves. You're right. People come in, they're dressed one way when they show up. Next time they come in for us to put their veneers in, they're dressed totally to the nines because they know when they leave, they're going to have the smile of their dreams.
So when should you do something about your smile? What's your advice?
as soon as you don't like it. As soon as you realize you don't like it and you'd like something better, why live with what you have? It doesn't make any sense.
Okay, well, that's good. So these people that were doing it, like this woman right here, okay? Beautiful woman. Do they tell you, I've hated my smile for 10 years, 15 years?
Typically they do. They're just finally ready to admit it
That's
and
a
do
big waste
something
of
about
time.
it.
So if you don't like your smile, do something about it.
Of course. I mean, why go through life with something that doesn't work for you? You spend more time trying to hide it than you do enjoying it. Waste of energy.
Wow, good for you. Okay, time for a few more photos. You're going to have to go fast because we're almost out of time.
Okay. Here's a lady. She had old dentistry in her mouth, the gray line around the crowns that she had.
Okay.
She didn't like that. She wanted to improve her smile. Had a little hiccup here on the left side where the teeth didn't flow.
Is that what you dentists call a hiccup?
Teeth don't flow well from front to back. So we created veneers and crowns on her teeth and gave her
Oh my goodness.
a whole new smile. She's an attractive lady already, but
That
the smile's
is incredible.
the icing on the cake. So look at the before and after, Randy. This is an older smile.
Yeah.
The gray line around the gums, plus she has a little hiccup on the left side
that
here
hiccup-
where the teeth go in.
Yeah.
And look at the after. So we broaden the smile. It goes all the way across into the corridors of the cheek. It's a more youthful smile. It's whiter.
Now, when you say the teeth follow the lip line, you're talking about the teeth actually are
following the lower lip.
interesting. So the smile that follows the lip line, you mentioned. Okay, now in that particular photo, her teeth are like perfectly following her lip. Now, is that tricky
It
for
is
you to accomplish?
It is, and that's where the artistic eye comes in, and the communication between us and the lab, so that we can we're creating these veneers on models, and those teeth then need to fit
Have to
into
match the face.
Right, they have to fit
I
into
mean,
the
by the way,
face.
and those don't look like veneers, but she looks like she could be a newscaster, an actress.
She's a
Huge difference from the before.
Well, thank you. She's a real estate agent who is very successful, and her smile has helped her along those lines.
She loves that. Okay, time for a couple more. What are we looking at? That looks like some jagged teeth right there.
This is a patient, retired teacher. Her teeth were getting old, getting thin along the edges, and she finally broke one of these. We had talked to her about the wear on the teeth. So she came in with an emergency, and we needed to do something about it. So we created 4 veneers to go across the front.
Very nice.
Again,
how old is that patient?
She's 62.
Okay.
So the teeth follow the lip line. We have a nice gradation of color going from the
Because they look a little
gum
yellow
line.
a little bit in the after. Was that on purpose?
It is, because they match the rest of her teeth. You know, it's an age-appropriate smile.
Interesting.
You don't want to put bright white teeth into somebody who's a little too old for
Oh, so
those.
you only did 2 veneers, so they had to be a little
No.
yellow to match the teeth?
No, we did 4 veneers.
4
on the
veneers.
front teeth
But so you had to go that color to match the rest of the smile.
to match the rest of the smile.
You're thinking of everything over there, aren't you, when you do this?
Well, look at the wave in the incisal edges of these teeth. It's a
What is
more,
that? Oh,
it's a more
interesting.
youthful look.
So they're not perfectly straight across.
Right.
That's
So
by design as well?
it is. So
Interesting.
gave her some subtle artistry there that,
Like a little wave at the bottom of the tooth.
right.
Interesting. Are you a perfectionist? I mean, do you consider yourself a perfectionist?
I would, and I certainly think my staff does.
Do they tell you that?
Yes.
Like he's a perfectionist? Interesting, interesting. Okay, time for one more photo. What are you going to show us here?
This lady came in. She was a new patient to us. Very energetic, lovely woman, dressed nicely, great hair, makeup, but an old smile. And
Okay.
she wanted to look like $1 million. And she said, I want the whitest shade you have. I don't care. I want everybody to know that I'm doing this. I don't want to just do it. I want people to know.
Okay,
So-
okay.
So we brought the teeth out that should be brought out. We certainly lighten the teeth. We have the teeth follow the lip line. So we've created a gorgeous smile that she wears this well.
Very nice. Okay.
She also was missing a tooth, notice in the before, and during our treatment she had an implant placed, and so then we placed the implant crown on the tooth at the end.
Now we're out of time, but what message, what do you want people to know about your practice, the way you practice dentistry?
We change lives, Randy.
Okay.
We turn back the clock. We let patients recapture that youthful feeling. we let people smile again. The subtleties necessary to create attractive smiles that fit the face begin with smile design, progress through proper tooth preparation, laboratory communication, and end with artistic, naturally appearing smiles. The value in being able to visualize and deliver that is what separates my office from the general dental office.
Well, good for you. Good for you. And your staff. Yeah, I mean, everybody that comes on my show brags about their staff, but you really feel like your staff, they're also like a team of artists as well.
We no longer think of ourselves as just another dental staff. We're a team of artists working together to create a positive total patient experience. And this heartfelt care, from time to time, the patients will mention to me, "Doc, you have a wonderful staff with a special approach to dentistry." And that makes me feel good because that's my reward for the day. Patients realize what it is we do for them and acknowledge that to us.
Well, good for you. You know, one last thing that I want to throw in my 2 cents here, because these photos are that good, that if you're going to get any kind of cosmetic dentistry, look at the photos. Now, obviously, you're showing your best photos, but if your best photos aren't that good, you better be careful, okay? So you have to look at the dentist photos.
Right.
Because your teeth are right in the middle of your face.
They're
and
everything.
There's big, blocky teeth, veneers that are out there. And so some dentists just don't, I think, have an artistic eye. And you do this all the time. I mean, I'm sure your first 20 were not as good as the way you're doing it now.
Absolutely, and it took a lot longer. We're much more efficient. We know what we're doing. We do it every day. So for us, it's second nature.
We didn't talk about training after dental school, but you've spent well over 1,000 hours learning cosmetic dentistry and bite and everything else.
And continuing to do so. The Pankey Institute, the Implant Institute.
Well, thank you very much. Good stuff.
Thanks,
Great
Randy.
stuff.
Pleasure.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com, and you can just put in Dr. Briscoe or San Diego Cosmetic Dentist, and he'll pop up, and you can, if you want a friend to see this interview, you can also direct them to that as well. And your video will be, we'll give you a copy, put it on your website as well.
Will do.
All right. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.